Good morning. This is Dr. Tyler Hamel, Kingwood chiropractor and nutritionist today, talking about disc bulges and disc herniations. This is more and more common these days, probably because we're very sedentary, working on computers a lot, hunched over. So in the neck, we see a lot of compression, bulging disc, herniated disc, pain in the neck, pain or tingly down the arm. But the same thing can happen in the low back. From sitting a long time, the low back disc gets squished, bulging disc, herniated disc, pain in the low back, and also pain sometimes down the leg all the way to the foot. So what is going on with this? So let's use a model to explain this a little bit better, because it's important to know this because many of you guys are having this issue right now. So we look at a vertebra like this. We can see the disc, a healthy disc here, right? It's pretty thick, spongy. And we look at the disc at the top here, same kind of thing. It's pretty thick. And when we look at the disc material from the top here, this red area, it is contained within this area, right? We want it to stay contained in there, ideally, because when it bulges or it herniates, it's no fun. So that's that model. Let's go to the next one. So here's the next model here, and we can see this disc here, it's definitely not as thick as the last one, right? It's lost some height. So when you see sometimes on an x-ray, especially on an MRI, when it says disc degeneration, that's what that means. Your disc went from here and now it's here. So when we look at the narrowing of the disc, then we look from the top view and we see now the disc material is coming out of the outside. Think of it like the jelly donut. Squish it on both sides, the jelly comes out. That's exactly what's happening here. And bulging disc or herniated disc, you see this yellow thing here is a nerve. So when there's a little bit of pressure, a little bit of extra pressure on a nerve, wherever that nerve goes, you could have pain, numbness, or weakness. That's why if this is in the neck and I have a bulging disc, it pinches on the nerve and I can have pain or numbness that goes all the way down to the hand. Some of you might have that. If this is in the low back, same kind of thing. If a nerve in your low back is being irritated, you might have pain in the low back or pain, numbness, weakness into the front of the thigh, pain, numbness, weakness all the way down to the bottom of the leg. So what can we do about disc protrusions or disc herniations? Chiropractic care works really well for this. We're trying to do therapy to take pressure off of that disc, right? The disc is being squished. We need to take pressure off that. So we can do that using chiropractic adjustments. Corrective exercises work really well. And even we have nutritional supplements that can really promote the healing of the disc. And the idea here is that the disc material will come back into where it's supposed to be, or even sometimes in a herniated disc, the disc material can come out of this area and be floating around, and it can just get reabsorbed into the body or into the system. That's exactly what happened to me. So I have a herniated disc about 2 months ago, and it was pretty bad pain in the back and into the front of the thigh. I had numbness in my thigh, but now it's completely gone. So that disc fragment, it can break off and be floating around, but it can get reabsorbed. So you just have to do the right things, meaning, so manipulation of the spine, corrective exercises, and nutrition. I did that consistently for 2 months, every single day on the corrective exercises and nutrition, chiropractic a couple times a week, and it worked really, really well. So we have patients coming in with neck and low back, disc protrusion, disc bulge. Keep in mind, this sounds kind of crazy, but anybody who you randomly just gave an MRI to, whether it be the neck or the low back, they're going to have disc bulges or disc protrusions. This is so 50% of the population, but it doesn't mean that they have to have symptoms at all. They could go their whole life having disc bulges or disc herniation sometimes and not even realize it, right? So this definitely, when you look at this or on an MRI, you see disc bulge, disc herniation, it is not like an immediate surgical thing, for sure not, right? We see this all the time, and you can correct this naturally. Sometimes if it's really bad, if the disc fragment is floating around or pushing on a nerve where it's just unbearable and it shouldn't be there in the first place and it's not reabsorbing, then they might have to go in and get surgery, but definitely not the first thought. So if you have a disc bulge or disc herniation in the neck or the low back, consider what I've said today. right? Now you know kind of the cause of that. It's mostly postural stress, right? We're squeezing in there. And the things that we can do to help alleviate the pain or the numbness or the weakness, either if it's in the arms or the hand or down the leg. Again, I'm Dr. Tyler Hamel, your Kingwood chiropractor. If you have any questions about disc bulge or disc herniation or your symptoms at all, put it in the chat box below. If you learned something from this video for about disc herniation or disc bulge, give it a thumbs up, share it with people. There are more and more people, more and more patients coming in with disc bulge and disc herniation issues, probably more than ever before, probably postural stress related. So we can get a handle on this, and no medicine, no surgery. This is all non-surgical stuff. And it's pretty simple. It makes sense. It's not rocket science. If you have any questions, please let me know. We're in Kingwood. You can always drop by here. You can give our office a call if you want to talk to me. 281-360-8387. Have a great day.